Hello, friends. One of the things I wanted to talk about that I felt early on into my breast cancer diagnosis, and if this is the first video of mine that you've seen, I am recently, June 4th, was diagnosed with aggressive invasive ductal carcinoma. I am HER2 triple positive. I'll call it triple positive. I don't know. Maybe I'm using the wrong lingo, but I am HER2 positive, estrogen positive, and progesterone positive. I believe my staging was a 2B, but as I've learned, the grade of the tumor is more important, and mine is a grade 3. Hence why they're calling it aggressive. So, back on May 19th, just to summarize, when I went to the ER thinking I was having a heart attack and found out, surprise, well, not too much surprise, once I knew I wasn't having a heart attack, and they did the CAT scan, with and without contrast, I was like, uh-oh, here we go. And I had the swollen lymph node. I pretty much figured, I knew that I was probably going to come out of the hospital with a breast cancer diagnosis, which of course they can't diagnose, but they did find a mass when they did the CAT scan. So just about 3 days later, I was able to make contact with a navigator, breast health navigator through the hospital, who in rapid succession, was getting appointments done, like appointments you would normally, or what I feel you would normally have to wait for weeks, if not a couple of months, to get into, simply starting out with mammograms and an ultrasound, then followed up just a few days later with a biopsy of both the breast mass and the lymph node. And then getting the results back from that, and then getting a PET scan, and then getting 2 different MRIs, an abdominal one and a breast one, meeting with the oncologist. That took some time. So about the middle part of July, and also meeting with a breast surgeon as well, who confirmed that I was going to need to have 6 rounds of chemotherapy, followed up by radiation if the tumor hadn't shrunk down, and then hopefully a lumpectomy would take care of what was left, and if it didn't, then, well, we have other options, mastectomy, and so forth, with reconstruction afterwards. So, appointment fatigue. I felt almost horrible for complaining about all these appointments, but I know that they were necessary, and obviously time is a factor in it, because my tumor is growing about 1% a day. In fact, the June 4th ultrasound, I believe it was on June 4th, measured it at 2.3 centimeters. But the MRI that I had done on, I think it was the 18th of July, measured it at 3.3 centimeters. So just know, if you are feeling a little down and bummed out, you're tired physically, but tired mentally as well from all the appointments, just know that it's normal. Even my health navigator, advised me that it was normal. And then there's also different stages of grief, and I can go into that in another video. You kind of have to grieve your pre-diagnosis life versus for what is about to happen. So, anywho, enjoy your day. Bye.